So who do we have involved? We have the pharmacy team. So when I first joined, that was Russell Morrison and Gillian Young, and partway through, Andrew Hart has joined us as well, with a change of hours for Russell here in the practice. They very much were looking mostly at the adding to the repeats more frequently than we were doing previously. They also added the permissible counts, and they've sort of spent a lot of time trying to streamline the systems. We were also very fortunate to have Lynn Reed as our pharmacy tech, and she did a lot of the EMIS and EMIS web searches for us to find patients in certain categories so that we could keep track on things. And she also improved our repeats by sort of rationalizing them. If you click. And then obviously we were involved. I would say mostly the work was done by the pharmacotherapy service, and I think they should get the credit for the reduction of the acutes here in the practice. But as such, we were therefore here to be able to answer questions for them about meds and the suitability of the patients for the different things they were doing. But then we also had to improve our documentation in our consultation notes so that they could have plans put in place for patients. So as an example, if I'm seeing someone and giving them HRT for the first time, I may give them 3 months, but I very much write in the notes, patients to come back and have a review appointment with me in 3 months if they're still having problems. Otherwise, I'm happy for this to go on repeat for a year. And we write much more obvious notes like that in the notes these days. Click, please. As I said, we were also fortunate to have Ashley Hose. I think we mainly sort of got offered her because things were so bad here in the practice to begin with, and the number of acutes was awful. And Ashley really did help. A lot of it was with the encouragement to keep going, to keep trying, have a look at this. She spoke to the staff about what they did when an acute request came through, or even a repeat request. She then worked out the pathway that happened with those requests, and she suggested that we tweak things here, tweak things there, try this and that. But she also sort of really made us keep checking the numbers and sort of doing mini audits to make sure that what we were doing was having the required result. Click, please. And then obviously the admin staff had to be involved too. They were sort of encouraged to be signposting to Pharmacy First more frequently, which they do now, but also they had to be more efficient when it came to the acutes, as I said, sort of trickling them through the week rather than giving us bolus days. But they also had to become more aware of the impact of the acute requests. And it's just helped the whole team to work together. Click, please. And now that more of the primary care improvement plan has come into play, our MDT plays a part as well, especially Roy, our mental health nurse, who is a superstar. He now deals with most of the antidepressant reviews, so that's taken away from the pharmacy team as well to the main. Click, please.